We've seen the ground of this well-trodden path before. The path that leaves us lonely and unsure. We try to run from the situations we're forced toward. What do we do? For the answers seem obscure. 1, 2, 3, 4. Break down those barriers that you preconceive, for you are the only one standing in your way. Be your own inspiration, there is everything to achieve. Your inner universe should shine every day. The world is meant to be seen through your eyes. This place is beautiful if you want it to be. What lies within you will raise you to the skies. What you decide to be will set you free. You have all the answers, now don't be afraid. Love yourself in every way. The deep blue ocean still kisses the shore. The grass still sways with the breeze. The sun will rise for you to adore, and love sings on the feeling of ease. You are not made up of words of undervalue. Wash off what society painted on your face. Take off your blanket of self-doubt, it's true. We are a fearless, independent, original race. You have all the answers, now don't be afraid. Love yourself in every way. We've seen the ground of this well-trodden path before. The path that leaves us lonely and unsure. We try to run from the situations we're forced toward. What do we do? For the answers seem obscure. 1, 2, 3, 4. Break down those barriers that you preconceive, for you are the only one standing in your way. Be your own inspiration, there is everything to achieve. Your inner universe should shine every day. The world is meant to be seen through your eyes. This place is beautiful if you want it to be. What lies within you will raise you to the skies. What you decide to be will set you free. You have all the answers, now don't be afraid. Love yourself in every way. The deep blue ocean still kisses the shore. The grass still sways with the breeze. The sun will rise for you to adore, and love sings on the feeling of ease. You are not made up of words of undervalue. Wash off what society painted on your face. Take off your blanket of self-doubt, it's true. We are a fearless, independent, original race. You have all the answers, now don't be afraid. Love yourself in every way.
Hello, everyone, and welcome. Health and strength, the power to pursue our dreams. Isn't this what we all want for ourselves? And moreover, isn't it what we wish for the beloved young people in our lives? Mental health is at risk for many, many young people across our nation and in our communities, and that risk is rising today. Meanwhile, our nation, our communities have struggled to provide the comprehensive early access to care that can help young people whose mental health is at risk push through that risk and go on to thrive in their lives. I'm Brandon Staglin, president of One Mind, and I've survived schizophrenia thanks to comprehensive early care. Now, thanks to a partnership between my organization, One Mind, the One Mind Elizabeth Brown Memorial Fund, the County of Sonoma, Kaiser Permanente Northern California Community Benefit Program, Buckelew Programs, Aldea Children and Family Services, On the Move Bay Area, and the University of California at Davis. A program just like that is coming to Sonoma County and is going to launch today. Today's event, the grand opening of the Elizabeth Morgan Brown Center, a One Mind Aspire clinic, is indeed a cause to celebrate. I'm so glad you're here with us to do this. 3 years in the making, the Elizabeth Morgan Brown Center is Sonoma County's very first coordinated specialty care clinic, providing gold standard care to young people whose mental health is at risk or is experiencing the early stages of serious mental illness. This clinic will provide the gold standard of care that puts patients and families first, to empower young people whose mental health is in jeopardy to recover to strong and successful lives. The clinic's care will continuously improve through its participation in a statewide learning healthcare network. The young people of this community deserve nothing less. The clinic is named after Elizabeth Morgan Brown, the talented, kind, and generous Sonoma County teen who tragically died by suicide in 2018. The video you just saw was made by Elizabeth. That's the kind of person she was. She wanted a better life for all the young people in her community, all the young people in the world. I hope that video inspired you. Her parents, Seong and David, have now joined with one mind to push through the process to make this clinic a reality, and I'm incredibly grateful to Seong and David for their relentless advocacy to make this moment possible. Today, we'll hear from Seong and David and the other amazing partners who brought this clinic to life about its significance for Sonoma County residents like you. And we'll experience a keynote from the legendary national mental health advocate, Patrick Kennedy, former congressman from Rhode Island. You will have the chance to ask questions of these heroes all throughout our program today. And we encourage you to do so. If you have anything you're curious about with the clinic or anything related to mental health, please ask your questions using Zoom's Q&A feature at any time. I hope today's conversations will inspire you to do three things. One, if you feel you are in need of help for maybe your mental health or that for a loved one, please reach out. Second, I hope that you will thank your county officials for their support for this program and encourage them to continue to support it in the years to come. And third, you might even want to take civic action to build even more support for this clinic and its mental health services in Sonoma County through an opportunity that you'll hear about in just a minute from Seong and David. So now it gives me great pleasure to introduce our speakers and panelists today, and all participants, please put on your cameras. I've already introduced Seong and David Brown, and I want to thank them again for their incredible advocacy that made this clinic possible. They'll be our first speakers in just a minute. Thank you, Seong and David, for being here with us today. Robin Betts is Vice President, Quality, Clinical Excellence, and Regulatory Services, Kaiser Foundation Hospitals and Health Plan, Northern California. Thank you, Robin, for being here, for all your support. Patrick Kennedy is a hero of mine who I'm lucky to also call friend. During his time in Congress, he sponsored the Mental Health Parity and Addiction Equity Act of 2008, which was a watershed moment when it passed for the affordable and accessible care for mental health for all people in our nation. He also founded the Kennedy Forum, which is the nation's premier mental health advocacy organization. And he'll talk with us about nationwide advocacy to bring early care for serious mental illness to be a reality throughout our nation. Thank you, Patrick, for being here. Tara Neendam, PhD, is a wellness warrior who I'm privileged to know. She's the executive director of the UC Davis Early Psychosis Clinics and oversees this clinic, the Elizabeth Morgan Brown Center, for its fidelity to the care model. She's also principal investigator of the California-wide Learning Healthcare Network, about which I mentioned before, which will do research to improve care in all of these clinics. Thank you, Tara, for being with us today. Claire Lampson is a senior at Bard College who aspires to a career in psychotherapy. She cares deeply about her twin brother who has experienced schizophrenia and is in recovery thanks to care at a Napa facility affiliated with the Elizabeth Morgan Brown Center. And Linda Hopkins, last but totally not least, is the 5th District Supervisor for the County of Sonoma. That includes the entire Sonoma County coastline, the Lower Russian River, many unincorporated villages, the city of Sebastopol, and the southwest portion of Santa Rosa. And she's a passionate advocate for social services throughout Sonoma County. Thanks to all of you for being with us today. Viewers, as I mentioned, anytime you'd like to ask a question of any of these wonderful panelists, please use the Q&A feature via Zoom. Okay, so let's get started. Seong and David, you're up first. Will you please share your story of your family's struggle to help Elizabeth and what you've learned from that struggle and how you're applying it now for advocacy to help young people all around Sonoma County and beyond?
Well, Seong and I have partnered with the amazing organization One Mind that has inspired us to work as hard as we can to help others get services that they need that we were not able to obtained for Elizabeth, even though she really wanted to work really hard to get better. I mean, that was her whole goal, was to get better.
Okay, thank you, David. That it's sad what happened to Elizabeth, but I really admire what you've done to make this into something beneficial for more young people all around Sonoma County and beyond. So thanks for all your work.
You're very welcome.
Absolutely. And now Robin Betts, I can think of no one better suited to shepherd the Kaiser Foundation support for the Elizabeth Morgan Brown Clinic.
Oh, thank you so much.
Yeah.
And it's so great to be here today. Kaiser Permanente is extremely pleased to take part today to honor Elizabeth's legacy. And we're honored to support the Elizabeth Morgan Brown Center, a One Mind Aspire clinic in partnership with One Mind and the Elizabeth Morgan Brown Memorial Fund. You know, as an organization, Kaiser Permanente is very committed to care for the total health of our members in mind, body, and spirit. So we continue to focus on innovations in mental health care delivery and outcomes by doing things like improving the actual physical space in which the care is delivered, or deploying new technology and expanding our capability to support our members and patients. So this includes the integration of mental health care into primary care, specialty care, and emergency care, coupled with a real focus on removing the stigma surrounding mental health conditions. So Kaiser Permanente is excited to partner on this project. The Aspire program's team-based approach to intervention, treatment, and support to patients as well as their families in Sonoma County is in full alignment with our organization's focus on mental health. So, and we know there is a growing need in our communities for specialized mental health care for youth and young adults at risk or living with early stage or acute onset psychotic illnesses. We're honored to help stand up a program for a patient population that has such high morbidity and mortality, and this program will really serve as a vital community resource. This center is serving a critical community need and provides full wraparound care to support the individual and the family. It is much more than counseling and intensive therapy. It addresses the patient's specific social needs. The care model explores housing, food security, and social support services that might be needed. And the model also identifies a loosely defined family member to become each patient's partner in health. That person makes a commitment to go on the care journey with the patient. This partnership really came to life through the perseverance, passion, and advocacy of David and Seong Brown. Their input and influence has also led to partnering with me and Dr. Yaner Balin to form a patient advocacy group within Kaiser Permanente that focuses on mental health care, which continues to this day. It really helps inform and support improvements in our mental health care and services, such as funding this Aspire program. So it's really critical to have the patient voice heard, and we learn from them every day. As we help stand up this program, Kaiser Permanente is also engaging in research to expand the footprint of the program with the objective of broader spread. So we're very excited to learn more from its successes as we partner with Tara and Carrie at the Napa clinic as well. All together, we'll be able to learn a lot from the patients and their care journey and the outcomes. So today, and in behalf of Kaiser Permanente, I want to thank the Brown family, One Mind, and all of the other partners for bringing the Elizabeth Morgan Brown Center, a One Mind Aspire clinic, to life. Thank you.
Robin, thank you very much. Can't say enough about how grateful we are for your support and how I look forward to this partnership continuing into the future. Thank you so much. Now, Patrick, it's time for your keynote. Will you please talk with us about the aptly called common struggle for mental health in which we're all engaged and the nationwide movement to bring early care for serious mental illness to bear for all who need it?
Yes, thank you so much, Brandon. And thank you, Seong and David, for your incredible generosity of spirit that you've taken your own struggle and that of Elizabeth, and you've turned it into a real opportunity for families to not have to go through what you all had to go through in trying to access the needed care for their family member. And I can't help but think of how, Brandon, your parents and your family were there for you, and as your dad likes to say, ran towards the challenges rather than away from them, and what a difference it has made in your life. And as long as I have known you, what an example you have been to others, that recovery is possible if people are given the right opportunities and supports. I also want to thank Kaiser for stepping up to the plate here. You know, it's not often that we have leadership in the payer community that are willing to really redesign the way care is paid for so that we incentivize the kind of treatment that works. The most unacceptable thing in this country right now is that we have many, many programs for various populations within the community of those suffering from both mental health and addiction challenges that can benefit from the types of treatment modalities like the Aspire, like this first incidence of schizophrenia treatment initiative. It's not as if we have to reinvent the wheel. We just have to put it on and get it moving. And I want to say what a hopeful thing that Elizabeth's memory will be marked by all the other young people who will be able to survive because they are going to be provided the care that she found so lacking in helping her make her journey. And I just think of my aunt, Rosemary, who's really challenged with an intellectual disability. And the experience of that in my family gave rise to my Aunt Eunice starting the Special Olympics, which today is in over 190 countries around the world. And needless to say, when my Aunt Rosemary was living, and especially when she was young, it was a source of great shame that she suffered from both a mental illness and an intellectual disability. And it really is something that my family, particularly my Aunt Eunice, saw an opportunity to bring other families together to work together to try to improve the conditions of people like her sister. And, you know, had, you know, Eunice not stepped up and then ultimately get the support of my grandmother and others in my family, you know, Special Olympics as we know it today might not be where it is. And all I can say for Song and David is that by sharing your compassion for other families who are going through what Elizabeth went through, you are really starting a kind of movement that will take away the stigma by virtue of the fact that when it is demonstrated that treatment works, people will not feel as if they're consigned to a lifetime of disability simply because they've been diagnosed with this illness. Today, for the most part, because we respond many, many times to multiple psychotic episodes, during which we know through the great work of One Mind and the Staglins, in the funding that they have provided over years of philanthropy, over $500 million, that we're able to really understand how the disease has a pathology to it, which of course, like other diseases, is progressive. In other words, if you don't interrupt the illness early, just as in the case of cancer, diabetes, or any other chronic illness, you're unable to see the real benefit of mitigating the long-term disability that comes from these very serious illnesses. And I think it says so much about this program that it's about that immediate wraparound for people who have experienced first incidents. And not waiting means that we respond in the urgent way that we would if it were a heart attack, if it were a stroke, as I said, if it were cancer and stage 1. And so it really is taking a page from how we address other illnesses and applying that to a set of illnesses that have been too long neglected in our country, mental illnesses and addictions. And I am just so impressed with the fact that we are looking at this in a holistic way and following the real example as Robin laid out, physical, mental, spiritual. You know, the whole person means that you treat the whole person. If you leave part of the continuum of care out of that care, it makes it more probable for people to fall through that set of cracks. And unfortunately, because of what we know about the mental health system, there are a lot of cracks. That we have a very fragmented system, as all of you are well aware. And the irony is we need a seamless system, especially for those suffering from these illnesses, because their care is so multifaceted. It really requires that continuity wraparound approach. And when people do not have that, in other illnesses, they might be able to just take medication. They might be able to just go see a physician or a health professional periodically. In mental illnesses and addiction, this is a constant challenge to stay on top of the illness, to take medications and to see therapists and to have a social support system that reduces the triggers and that come from stress, essentially, which is such a trigger in itself, and allow people to live in a balance which really permits them the most optimal chance to succeed. If I sound like I know what I'm talking about, I'm someone in recovery from both bipolar and addiction, and I know of what I speak because I know what's worked well for me in my life. And when I treated my illness as a series of episodic events, you know, it was a chronic illness, and it was never going to get on the right road to recovery. When I was able to put recovery first and put the support systems around me that have me in an optimal position to succeed in recovery, then recovery works. And Brandon can really testify, and does through his Brainwaves program and through many other appearances, to the fact that these illnesses do not need to be kind of identified as illnesses that are intractable. They are very severe, but if we move early, we can really minimize that disability, the illness progressing, as I said, and in turn, people are not going to be faced with the kind of side effects of the medication down the line that often lead them to want to leave their medication. So in essence, if we did what we needed to do early, we would be really establishing a road to recovery that is a lot easier for the patient themselves to be able to maintain, and understand that it is takes a lot of determination from the patient to be able to stick with their journey. So anyway, I just want to say, you know, we are in the midst of a major effort to finally bring mental health back into, frankly, into overall healthcare, not back because it probably never was, but I can see a couple of initiatives that ought to be immediately taken to scale. And when you look at the impact of untreated illnesses, especially in the SMI world with psychosis and schizophrenia, it just seems to me we ought to start there because it is the place where we can make the biggest difference the most quickly. This is not something that we have to really fine tune all the aspects to know what the true outcomes are. We know what the outcomes are going to be, and they are so measurably positive that to not do this type of early intervention is to put our head in the sand and neglect what really works. And so having this program now makes a big difference, because it really will provide a further affirmation that early intervention and wraparound services for young people's challenges really will make the biggest difference in their lifetime trajectory towards recovery. Thank you for allowing me to join you. I'm happy to participate in some of the questions afterwards. Thanks so much, Brandon.
Wow, thanks, Patrick. That's a rousing endorsement of this form of care and the movement to make it more prevalent. And thank you so much, Patrick, for your great talk today and inspiring everybody like you do so well every time. Yeah, so what we have some questions from the audience, and viewers, please feel free to ask questions at any time of Patrick or Seong and David or anybody else here that you might have. And we do have one question. Oh, by the way, please use the Q&A feature of the Zoom to ask your questions so we can track them easily. Thank you. First question, Katrine Siafa from the audience is asking, will you share a little about how the clinic will operate during COVID-19? Fortunately, we have Tara Needham here, who oversees the care in the clinic and oversees clinics like this in Sacramento and so forth. And she would be happy to answer that question. Tara, please, how will the clinic operate?
This is a really important question right now, especially as we're trying to improve access to care. That's a core feature of this clinic. So, one of the things that many of these clinics have been doing is using Zoom, like we are right now, to connect to the home, to people's cell phones, and really provide them care in a safe place called their home, out in the community, whenever they are available to talk. And that's been working really, really well for many individuals and their families. One of the things I've noticed in my clinic is that we get more time with the families and to really create that supportive environment for the individual who's working towards recovery. For those folks who don't feel as comfortable with technology, and that's the case for some people, the Elizabeth Morgan Brown Center will have the availability to see folks in person with PPE so that it is safe for the staff and for the clients and families. So we're going to work really hard to make sure that folks can get access to the care they need.
Mm-hmm. Yeah, thanks, Tara. The clinic's working really hard to do that. And I understand that if there's a need for it, they can even send someone to your home if that's something that you're comfortable with and would like to set up in order to help people feel comfortable with the care in general. So.
Definitely, that's part of our model. I think then for us, at least during the time of COVID, most of those home visits have been done outside, again, to just make sure that everyone is in a safe space while we're still managing COVID.
Makes sense. That's great. Let's see. Patrick, may I ask you another question? So the first question of our panel round is about something you touched on at the beginning of your talk, and that's private insurance coverage for this type of care. And in this particular clinic, as it gets started, the care will be available to anyone regardless of insurance, but Kaiser does cover some of the insurance coverage for its members. It's counterintuitive, but generally true that public insurance geared for folks with lower incomes like Medicaid or Medi-Cal often gives better options for care for mental health than private insurance. But now that's starting to change with this clinic right now, which is awesome. Why is this innovation an important step toward enabling more families to access life-saving care? And how does this fit into the national push by the Kennedy Forum and others to expand access to mental health care?
Thank you, Brandon. For people to really dig deep into this, the kennedyforum.org gives you a whole series of tools to research how your payer needs to be held compliant to the Federal Mental Health Parity and Addiction Equity Act, which I was honored to be a co-author of, but also we should know that we're doing this in each of the 50 states, and there's something called a parity track, which people can look to. And I'm happy to report, should Governor Newsom sign SB 855, and I would encourage everybody watching this, write down 855, SB 855. It will do more to guarantee private insurance coverage, and in a much more extensive way than is guaranteed under state law and state regulation today. And the good news is that no payer is going to be put in a bad spot because they all have to comply with the same rules. And that's part of the problem with our system, is that there's no incentive for long-term kind of investment in mental health, which is really the most promising type of investment. And this is a perfect example. We have to work with payers to come up with an incentive system whereby they all benefit by investing in prevention. When I was a state representative in Rhode Island, we got all the payers to come in at a capitated rate of their market share, percentage of their market share. So none of them were disadvantaged and paying more than their share, but they all put in a prevention fund. That prevention fund was then used for what all the payers felt would be good for their mutual benefit as a payer community in Rhode Island. So what you had is they wanted to invest in things, much like Kaiser's doing so nobly and stepping up here, like Aspire, but they couldn't justify it with their quarterly earnings. And so they would employ much more stringent medical management practices because they just can't see the benefit, the long-term benefit of doing these early investments. But if you change the incentive system to really reflect that, no, there's a huge payoff in reduction in both mortality and morbidity, this is where you want to go. But that's where you need the government to help be an arbitrator so that the private healthcare system can work to compete not on who can be denied care more, but rather on who can provide better care. And they really shouldn't be inconsistent. And I think that this is a terrific opportunity. As you know, in California too, we have, thanks to many others, Darrell Steinberg, former Senate President, and many others, Prop 63, which has been a lifesaver for so many families because it does provide some supports in communities where they really don't have those extra costs covered, as was mentioned before. And so what we do need to do is really look at this so that payers aren't incented to kind of push people off onto the public system. And the irony is, in Congress, we're working with Republicans and Democrats, and the Republicans like this because they don't want, obviously, higher taxes or the government to be subsidizing a for-profit industry like health insurance. So the idea is, yes, make a private health insurance, but make a profit where you are showing demonstrably better outcomes for the investment that you're making. And if we have to work with you to come up with those systems, then that's our job as advocates. And I thank all of you for helping develop that advocacy. Without advocacy, we can't implement a lot of these things that we know can make a difference.
Wow, Patrick, there's so much happening and that we can get behind at the governmental level to make this more prevalent for people who need the care. I might also mention that there's a law that passed in California. I'm proud to have helped in the writing and passage of the law with the Steinberg Institute, called AB 1315, the Epi Plus law, which this clinic is receiving funding from as well. And this is fantastic. We're grateful for that. There's going to be another round of funding available for more counties in California to receive funding from this to get their early care clinics started and up and running better. So I urge viewers, if they are in a county outside of Sonoma County, to advocate with their county to apply for this funding. So thank you.
But as an example there, Brandon, you could basically have all the payers based upon market share, Kaiser, Blue Cross, the others, say, we're all going to put in a percentage of our market share, and we're going to put it into this prevention account. All of us can recognize the absolute solid evidence of first instance early intervention. And what it could do is actually roll the money that you already started to get rolling from the state through the legislation you helped pass. It would further buttress that and move that forward. And everybody, as I said, would benefit, and no one would be put at a disadvantage. In other words, Kaiser wouldn't have to be out there shouldering the initial burden of all this, because they have a holistic model of care where they really see the synergies of helping one part of you in order to benefit all of you. And all the other payers need to be recognizing that as well.
Absolutely. Thank you, Patrick. We have a question from the audience. So a couple of questions that are related to each other from different audience members. Thank you, viewers, for your questions. This one from Tori Nosler. Thank you, Tori, for your question. Can you discuss how the referral process to the center works? Can families self-refer? Is all insurance welcomed? And then question about also family has a young person who has delusional disorder, and would he be eligible for care in this clinic? This person is in Napa. So Tara, would you like to take this question? If not, I can help.
Thanks, Brandon. Yes. So yes, anyone can refer to this clinic. We will provide a variety of ways in which people can connect, but for family members, the first step is going to be calling. And one of the pieces I like to remind folks, if you have an adult who is the one seeking care, if the family's going to call, just have that adult nearby so that they can also say, yes, I'm willing to come in. That just helps. We are going to be doing a number of outreach activities across Sonoma to help educate the community about the program and providers, and provide them really seamless ways to get people linked to care. The program is going to be serving up to 40 clients, and we will be taking a variety of different types of insurance. And let's see here. I believe we're getting the phone number is 707-225-1855. Again, that's 707-225-1855 to give us a call if you feel like someone needs help. Was there another part to that question, Brandon, or did I get everything?
You covered everything very well and more. So thank you, Tara. That was great.
You're welcome.
As always. Yeah, and when you call that number, please ask for Jackie Aguilera, who's the program director, and she speaks English and Spanish and can help you with questions about the clinic as well as questions about mental health in general. So thank you. Looks like we have another question from the audience. Does the clinic have the ability to treat body dysmorphic disorder with self-harm component? Looks like we have someone who knows somebody with this condition. Tara, would you like to answer that?
Yeah, I mean, I think I would like that person to call. I think the delusional disorder question, body dysmorphic disorder, give us a call. We do a very thorough phone screen to really understand what's happening for the individual and then make sure they get linked to the right care. So if the right care isn't us, we will be sure to help hand off in a very warm and supportive way to the right place, because we want to make sure folks get to the right place, as Patrick said, as quickly as possible. And if that's not us, we will make sure we support you in that.
So that's fantastic. It's connected to more care centers to help whoever might need help in different ways. So that's great. So Tara, first question for you from me. You've overseen coordinated specialty care clinics such as the new Elizabeth Morgan Brown Center for many years now, at least 5 or 6 years. And you also started a learning healthcare network to bring together programs across the state to continuously improve the quality of their care through research. As part of this work, how does the Elizabeth Morgan Brown Center, a One Mind Aspire clinic, address the mental health needs of Sonoma County youth while helping to improve care for the whole state?
Thank you, Brandon. Yeah, many states have started to recognize the importance of early intervention for mental health needs and the need to target youth and young adults. But the access to these services, as Patrick was saying, falls short of the need. And some recent research has really shown that the need for these early intervention for serious mental health services is significantly greater than we originally thought. And so because of these limitations in access, the youth that are affected are diverted away from their prior path, away from family, friends, academic, and career success. And because they're struggling and not getting the help they need, they end up having experiences with substances, they struggle financially, emotionally, and then for some individuals, they end up homeless or dying by suicide. And these are terrible but preventable negative outcomes. And so that really speaks to the need for the clinical services, but we also have an important need for data, as Patrick was saying, to show that these programs work and that the investment is worth it to get the outcomes that we want to see. So what we're doing as part of the Learning Healthcare Network, which the Elizabeth Morgan Brown One Mind Aspire Clinic will be part of, is we are going to collect data, systematically collect data on areas that we have learned from our stakeholders are important, so that we can show the impact of this program on the outcomes of the individuals it serves. And so this, this limitation in data that we've had thus far has hindered our ability to show how these programs transform and save lives and save money. So again, the Elizabeth Morgan Brown Center, a One Mind Aspire clinic, is going to do both of these things. It's going to create this groundbreaking clinical service to support the youth of Sonoma County, while also collecting this state-of-the-art data to demonstrate its impact. It's a very exciting opportunity.
I am really excited about this too. I'm also excited to hear about the personal experience of a family member of somebody who experienced schizophrenia. Claire Lampson is with us. We're so lucky to have her here with us today. Claire, you have a poignant personal perspective on the mental health needs of Sonoma County youth. Would you please share your story and that of your brother with us?
Sure. Thank you for introducing Brandon. As he's saying, one of the best ways to destigmatize mental health is through humanizing the experience and sharing the stories. So I'm here to share a little bit of my perspective from my experience of having a twin brother who has been suffering with schizophrenia for the past 2 years. My brother's illness began on the eve of our 20th birthday. I was out with friends on our college campus in New York, and Evan was at home in his dorm room. And I received an unusual text from him asking for me to come by and visit him, as he was having a hard time that evening. And when I arrived, I was struck by how I felt like I couldn't read where he was, emotionally or mentally. And our close bond as twins and friends made this a very unsettling and unnerving experience. And unbeknownst to both of us, that evening marked the beginning of his psychotic break, and one that would lead to his eventual diagnosis with schizophrenia. Over the next week, I stayed with him as his illness took hold, and neither of us slept very well, and his behavior continued to become less like himself. But because of my own experiences and our family's history of anxiety, we all figured Evan was simply dealing with a bout of existential dread and worry, an experience that most of us face in college, if not at another point in our lives. However, we began to realize the severity of Evan's symptoms, and because our insurance provider didn't cover care in New York, sort of some of the accessibility issues that other panel members have mentioned, we decided to have Evan come back to California to recover and recuperate with our parents in Sonoma County. Unfortunately, Evan's symptoms only continued to escalate from that point on, so much so that he needed to return to the ER, and this warranted his eventual stay at an inpatient center in Sonoma County. And in spite of a lot of dedicated and well-intentioned staff members and professionals, his stay at this center was inadequate for Evan's symptoms, and we found that the process to find him early intervention care that Brandon and everyone else is speaking about was muddled in bureaucracy and financial inaccessibility. And beyond this, our family faced difficulty receiving adequate care for each of our own mental health needs as the impact of Evan's illness rippled through our family system. So we're immensely grateful for the strong and loving community that we did have during this time, and the support that they continue to give us. And it's because of these challenges that I'm relieved and optimistic for the vital work that the Elizabeth Morgan Brown One Mind Aspire Clinic is doing in Sonoma County. In spite of these systemic barriers, and in large part because of our family's commitment to his recovery, Evan is lucky enough to be receiving care through a similar program. And most importantly, he is receiving specialized and holistic care that directly works to address his illness. So I'm very hopeful that many more youth in Sonoma County will be able to receive this kind of treatment. And I'm here to help destigmatize the experience and open avenues for healing for those suffering and for their family members. Thank you.
Claire,
Thank you.
that experience. It's inspiring to hear how you and your family have worked with Evan and not given up to get him the care that can help him to recover to a full, fulfilling life. And I had the privilege to talk with Evan myself, and I really like him. You know, he's got a great heart, great spirit, and I hope for the best for him as well. Thank you, Claire, for sharing that. We'll come back to you in a few minutes. We have a question from the audience. Belinda Biscoccio, I hope I'm pronouncing your name right. Congratulations and hopeful and happy birthing of the EMB Center on Elizabeth's birthday. Will there be regular or periodical Zoom sessions to inform and educate the community and Q&A with the public on mental health problems and initiatives? Thank you. I can start by answering this in one way, and then I'll throw it to somebody else who's here. So One Mind does offer our Brainwaves Webcast. It's a weekly webcast talking about the mental health challenges that we face in our society, including these. We'll have an episode on the Aspire program in the months to come. But for mental health in general, it's a great resource to tune into, and I hope you will view it at onemind.org/brainwaves. Believe that there will indeed be some public educational sessions run by Buckelew programs that will be hosted on Zoom, indeed. They will be, I believe, a weekly cadence, and we do have somebody from Buckelew with us today. Chris, are you able to join by video and talk about this a little bit? Chris Kuhn, the CEO of Buckelew Programs. You can just do audio. Okay, that's good. Yeah.
Am I there? Okay, sorry, wasn't prepared to step in. Yes, thank you. Yes, through our Family Service Coordination Program, we offer tons of support to families, folks who are struggling with a loved one with a mental health challenge. So we do outreach, Zoom calls, we have regular meetings for families to get information and to navigate the system. And we have traditionally been funded to serve adults, so 18 and over, but we recently had an opportunity through St. Joseph Behavioral Health. Now we're going to be working with youth as well. So certainly great timing at the opening of the center here as well.
Mm-hmm. All right, thank you, Chris. That's great to hear. Another question, from Katrine Chiaffa. Thank you, Katrine, for your next question. Would a young adult with severe depression be eligible for services? Tara, would you like to take this, please?
Give us a call. You know, I think that those are any questions that you have, give us a call and let's see if we're the right place. And again, if we're not, we're going to help get you to the right place. Yeah. All
right. Thanks, Tara. That's hopeful to hear. Again, that number is 707-225-1855 to call. Another question from the audience. Ray Simmons, thank you for your question. Can you explain what the services look like? Tara, I think that's another one for you. Would you care to field this one, please?
This is a great question because many folks may be wondering, how does this differ from regular outpatient mental health care? And I want to be clear, this is outpatient care, not inpatient care. So what I like to say is that we kind of wrap the individual and their family, whomever their family is, their support network, in our services to make sure that we're supporting the whole system towards wellness, as Patrick was saying. So we have psychiatric services for medication and physical health care support. We have clinicians who are trained in evidence-based practices, both for assessment, to really understand what's happening with the individual, as well as treatment, so that we can provide them with the education and skills to manage the experiences they're having. We will have peer providers who have lived experience with mental health to be able to connect on that level, and also support the individual and their family to engage in recovery services. One of our more important things is supported education and employment, helping people, stay working or in school or get back to work and school to really be able to continue on that path. There will be a variety of groups available for family members, for clients and family members together, that we're going to focus on communication, problem solving, coping skills, again, to make sure the whole system understands what's going on and has the skills they need to support the person and each other in managing a difficult time. So really you can see that it's whole person care through a team that works together to make sure that everyone's communicating and making sure that they're aligned with the clients and the family's goals.
Mm-hmm. Yeah, it's a beautiful model. I've had the privilege to work in 2 of these clinics for my master's program, and it's great to see how it brings the groups together to talk about how they're dealing with their challenges, and it's just a great system. Thanks, Tara. Mm-hmm. So I do want to ask one question of Supervisor Linda Hopkins. I'd like to bring you into the conversation, please. Thank you so much for being with us today, Linda. The environmental challenges of the last few years, from the wildfires to the pandemic, have placed tremendous demands on Sonoma County's behavioral health system. Can you please describe the feelings of the community about these growing mental health needs, and how do you see the Elizabeth Morgan Brown Center, One Mind Aspire Clinic, fitting into the county's overall work to address these needs proactively?
I just want to start off by saying how lucky I feel to stand virtually shoulder to shoulder with such spirits that we have with us today. The indomitable spirit, the tireless advocacy for mental health services. There are some amazing human beings on this virtual grand opening, and I'm honored truly to be part of it. I especially want to recognize the lifelong advocacy of Patrick Kennedy, also my colleague on the Board of Supervisors, Shirley Zane, David, Song, Brandon, and Claire, specifically for breaking the silence. Because what you are doing by talking proactively about mental health and mental illness is so critical in our ability to respond as a community. And what I'm seeing really for the first time in my life, quite frankly, the confluence of the willingness to talk about it and then these traumatic experiences that we have all gone through in Sonoma County means that for the first time ever, we can actually talk about how to respond, about how to enhance mental health services, about how to make sure that that trauma that we are all experiencing, that, it's been wildfires, it's been flood, it's been pandemic, that we actually have the tools we need to meaningfully address mental well-being through these repeated crises. And I think that it's also just deeply inspiring that in many cases this is done in honor of folks that are sadly no longer with us. And so thinking about the spirit of Elizabeth, the spirit of Peter, Shirley's husband, and the ability to save lives in the future, that's why we're here. And that's what I'm hearing on this panel that's just really inspiring me to my core. I come to the conversation as a sister of 2 brothers who face mental illness, and also as the daughter of a father who struggled with mental illness that was, quite frankly, untreated for decades and left permanent ramifications for his entire family as a result of that lack of access to care. But really what I come to this conversation as today is also as a mom of 3 kids and thinking about the impacts of these repeated trauma on the children in our community. We have kids who have now multiple times had to pack up all of their belongings and flee, sometimes in the middle of the night, not knowing whether their homes would be there when they came back. And unfortunately, we also have children who came back and saw their parents crying as they sifted through the ashes of what used to be their home. And so when you think about what Patrick was talking about, which is, how challenging it can be to recover when you don't have that support system, and then you look at what we're going through as a community right now. With the pandemic, you're seeing a loss of our social fabric, right? You know, children aren't able to go to school, aren't able to get that support from their peers, aren't able to potentially get that early intervention from a counselor or from a teacher. And then you add on to that the stress of fires, the stress of smoke, of being isolated in your own home because the air quality is so poor. All of this is extremely triggering, and it can easily cause a loss of that recovery if we don't meaningfully take care of folks. And so honestly, I feel like there could not be a better time, a better moment in time for the Elizabeth Morgan Brown Center, because we need to wrap our arms around our youth, knowing that they are facing a world that in many ways was unimaginable just a few years ago. I don't think there's any parent who thought that we would be, you know, not sending our children to school, that they would be facing repeated wildfires and a pandemic. And so I think it's just so critical to provide the support. And I think this is going to be a critical block in the foundation that we are building for mental health supportive services in Sonoma County.
Thank you, Linda, for that perspective on the traumatic experiences of so many Sonoma County residents, including kids. And it's heartrending to hear that so many people are going through these challenges, and it does hearten me to see that programs like this one are becoming available. So thank you for your support. I do want to mention something that Tara has mentioned. This program does provide trauma-integrated care to address these concerns that Linda was discussing. UC Davis is a national leader in this area, integrating trauma care with coordinated specialty care for serious mental illness. So that is part of what the Elizabeth Morgan Brown Center will offer. Do you have some more questions and comments from the audience? I'd like to bring them up now. Ellie Dwight, thank you so much for your comment. I want to thank and acknowledge the tireless work of the Brown family to bring critically needed resources to our county. Early intervention and an integrated family program will save Sonoma County lives, and to applaud the courage of young people like Claire Lampson and other advocates willing to tell the stories that are so needed to bring about understanding and change. I'm filled with awe and gratitude. Thanks, Ellie. Thanks for being here with us today. A question from the audience, Mary Beer. As paranoia is so often a major part of the early onset of schizophrenia, can you speak a bit about some of the ways that this program will develop a sense of much needed trust for new patients? Thank you all for this much needed program. Tara, I think that's another one for you. Would you answer that, please?
Of course. Mary, you're right. This is a very common symptom, this sense of fear and distrust of others or of technology or what have you, that many people experience when they're having the onset of their illness. And so for us as providers, I think it's really just trying to meet people where they are, acknowledge that they don't know us, acknowledge that this is scary and that this is different, and that some of the experiences that they're having feel real to them, and to provide them with education about the illness, to try to normalize and destigmatize so that folks will feel comfortable sharing with us. Sometimes it takes a while just to build that trust as people in that relationship so that a person can be vulnerable. And so we take the time to make sure that we lay that foundation of trust so that an individual can share these symptoms that can be very, very scary for them in the moment.
Yeah, I remember when I was first diagnosed with schizophrenia, I didn't want to admit that I had this condition, didn't want to talk about it. I thought I could just handle it all on my own. That's what I wanted to try to do. And I didn't want to open up about it in any way. You know, I didn't know how to share that with anyone. So it's great programs providing that kind of trust building time and personal attention that will build that.
Yeah.
Thanks, Sarah. So I'd like to turn to Song and David. Song and David, Elizabeth was a tremendously caring young woman. How do you envision the therapeutic alliance approach of the Elizabeth Morgan Brown Center or One Mind Aspire Clinic, which will partner with each young person and their family toward building the stability and the skills to succeed according to what they care about, to be of particular benefit to young people facing serious mental health challenges?
Yes, thank you. Thank you, Brandon. I kind of liken to what our experience was being in a large stadium, and there's one bathroom in that stadium and nobody knows where that bathroom is. And you're trying to find it. You're asking everybody, where's the bathroom? And nobody knows where it is. And you're looking all over the place. And that's what we were like, trying to find help for our daughter. And you know, eventually, you know, the pressure gets so much that, you know, you don't know where to turn. No one's providing you the answers. This program, you know, will provide you answers. If it's not the right program for an individual, they'll help you find the right services that you need. We didn't experience that. We asked questions to so many people in so many places and still couldn't find that thing that was going to help our daughter. The program, you know, not only provides, you know, the resources that are needed to help the person move in the direction that's going to help them, but it also provides those wraparound services that are so essential that our daughter never got. You know, having the family closely involved and educating the family about what their child or loved one needs and how they can best support that is so important. And we were kept out of that whole program of trying to assist our daughter, and our daughter wanted us to help, and she knew that we had her best interest in mind, and signed all kinds of disclosure documents to allow us to be a part of the program. But every clinician that we worked with kept us out of it. And that whole part of mental health care services absolutely has to change, because it's the loved ones that they have trust in, that can help them, along with everyone else that is close to them, is so important. And then, you know, there's also the clinicians talking to each other. They didn't talk to each other. You had a psychiatrist that didn't talk to the therapist didn't talk to the psychiatrist. And, you know, why is that? That's insane. And so it's such a collaborative group that would work together to help that person. It's like a slap header, you know, why didn't we have this available to us? So we're very excited about the Aspire program being able to provide the services that these young folks are going to need.
Yeah, I just wanted to say that the will of family members wanting to help and being there is not enough. And we, as parents and family members of loved ones suffering from this illness, that a lot of times that people don't talk about it, they don't know who to turn to, and we almost misunderstand this is our responsibility to care for our loved ones with the illness. But if you think about all other physical illness, when they're having trouble, you go to the doctor, and then the health providers gather the team of specialty members and all the people there with the expertise. They gather the team to care for patients. And that wasn't the case for us. And I know that a lot of people we know with the cancer, they have this support system when you go to their healthcare providers. Mental health is not like that. And it's all episodic and treated in siloed manner. And it's just so fragmented. It makes no sense how they think they can help the patients and get better. So this has to change.
Seong and David, thanks for sharing your testimony. So many families go through these challenges, and you're an example of, will hopefully inspire other families to look to this program and others like it to find the help that can benefit them. What was I going to say? I think part of the conversation that has to change is around acceptance of the needs of people with mental health challenges as a common human thing, right? And I think that's part of what you're working to help society change as well.
Yeah, I would like to really encourage everyone that we need to talk about this, and we need to advocate for people who are suffering with this illness, because they don't have a voice, really. At this point, they're the voiceless, and they don't know where to turn to. And some family members are so embarrassed about this, and somehow there's a misunderstanding. This illness is something to be ashamed about. We really need to change that mindset. The people with illness, they did not choose to be sick. But yeah, we blame the patients, and some of the healthcare providers blame the parents and family members for some reason that some dysfunctional dynamics within the family would cause this illness. These kinds of misunderstanding has to change. As I'm talking about it, I just can't even contain myself to be emotional about this. And we cannot say enough of it that we really need to change the mindset. And as we understand this, and as we talk more about it, there will be more research and development, and there will be more funding to help the people who need this help and support. And it's just really a human rights issue when you really think about it.
And we're very, very fortunate to have ongoing conversations with Kaiser Permanente about trying to change these types of things. And so we're very fortunate to have a relationship with Robin and Kaiser and Yanir at Kaiser. It's so we're truly believing that there's hope that healthcare providers are gonna wrap around the programs like the Aspire program and make a difference and change the way mental health care services are provided in this country.
Awesome. Thanks for your advocacy and for sharing your views on this, because they're just so at the heart, I think, what so many families are going through and experiencing. So thanks for your inspiration. I'd like to turn now to Tara. So first a question from the audience and then a question from me, Tara. A question from the audience, Maria Bistu, hopefully I'm pronouncing that right. Thank you, Maria, for your question. Will the Sonoma program be providing all the components of the EDAPT UC Davis program? And then building on that, how will the UC Davis work to help train programs like this Elizabeth Morgan Brown Center and others around the state to deliver that type of care?
Yeah, thank you. Thank you, Maria, for this question. Yes, we will be working with the team at Buckelew and On the Move and Aldea to bring all of the components of the coordinated specialty care program that we've been talking about to Sonoma families. I do like to say also that we want to see what the needs of the families and clients are as well. Perhaps we want to prioritize certain things, and there's flexibility there based upon the needs of the community as well. So we have a model, but it's flexible. And so we'll be looking for feedback from families and clients to help us understand how best to support your community. Brandon, hearing David and Song's story, I've heard it before, and each time my heart aches when I hear their struggle for finding care. I just hearing this idea that providers don't talk to each other, they don't coordinate, they don't let the family in the room. Like, these are just silly things that really hinder somebody's road to recovery. Why would you close out the people who support them every day? That doesn't make any sense to me. And so one of the things we are most excited about at UC Davis is the opportunity to spread this model, to bring in other counties, other communities, and make this type of care more available to the folks that need it. And so as part of the AB 1315 bill that, Brandon, you were instrumental in getting passed, and the Staglin family really championed this notion of spreading this work. We need to get it everywhere. And we want this work to be available for all Californians, regardless of their insurance, their ability to pay, all of these barriers that Patrick talked about. We really want to break that down and make sure all folks can have access. So we're very excited to be part of AB 1315 as we provide training and technical assistance to the counties who want to implement this work so they can understand how best to do it, again, within their unique communities. It's going to be a very exciting time for us.
That's super exciting to see this AB 1315 come to fruition as well, and enable more counties to deliver this type of care the Elizabeth Morgan Brown Center is delivering, and you're an instrumental part of that as well. So thanks, Tara, for all that you do. Lots of great comments coming from the viewers about thanks to Song and David for their advocacy and their vision for finishing the work Elizabeth started. Thank you for. It says you are exactly on with the fractured and disjointed care in the mental health field. So thanks, Song and David, for your impassioned and very right-on testimony. Thank you so much for all that you do. I'm so glad we're on the same team. Looks like we have a comment from the audience. Gili Malamed Lev, hope I'm pronouncing that right. Wonderful circle of caring people and professionals. Thank you, Song and David, for being at the heart of this work. Keep up this most important work, holding Elizabeth in my heart. Thank you, Gili. And also Anna Del Monte, thank you for your good work, she wrote, and that's been voted up once, so that people are agreeing with that. Thanks, Anna, for your comment. Great. So I'd like to turn to Claire again. Claire, based on your experience, what are some of the most important ways that the Elizabeth Morgan Brown Center can start to address the mental health needs of Sonoma County youth, from your perspective?
Hi, thanks. Yeah, well, it's been great hearing Tara specifically speak about the actual way that these different practices will be implemented in the clinic. And I'm really excited to hear that it's going to be a holistic effort with the families, as David and Song are speaking about. I think that's so important and vital to recovery. So yeah, I would just say that I'm very excited for the work that they're starting there. And I think that helping the whole person is the most important thing, especially for younger people who are struggling with this and for whom it's very scary and a novel experience. So thank you all.
You're welcome, definitely, and thanks for your perspective. Do you aspire to provide that type of holistic care when you become a psychotherapist?
I do, yeah. Yep. I think that I'm hoping to work with children specifically and getting this sort of holistic care even younger than the youth that this clinic will help. So, yeah.
She says, thank you from Jody. You're bringing so much light to Sonoma County. Love to you and everyone involved. Thank you, Jody. Question now for Linda. What can Sonoma County residents do to help ensure that the Elizabeth Morgan Brown Center and other vital mental health services get the public support they need to succeed?
That's a great question. And I'm going to, I think, put on my political hat a little bit on this one, because I think that we have major changes that we need to make politically in order to advance the cause of mental health. But number one, first, talk about it. I think that breaking the silence is so critical. Being able to share those personal stories, quite frankly, expose your own vulnerabilities, that's the way to really change hearts. And then that changes minds when people go to the ballot box, right, to cast those votes. Number two, vote for candidates that prioritize mental health and services and that acknowledge that, you know, parity isn't just something that we talk about, it's something that we need to actually implement. I want to acknowledge what Patrick said earlier, is that mental health services should be a bipartisan initiative that has broad-based support, because it is actually fiscally responsible to make upstream investments rather than treating mental health crises when they reach that crisis level. And we also see, you know, tremendous impacts of lack of mental health services and lack of behavioral health services in red states and red counties, as well as blue states and blue counties. And actually, in many instances, we see quote unquote deaths of despair more prevalent in some of those rural small towns that tend to be more, you know, red dominant and politically. And I want to say something about the phrase deaths of despair, because I hate it. And yet that is what we often hear in the media. It's not a death of despair, it's a lack of treatment, right? Mental illness illness is treatable, but left untreated, it can be a terminal illness. And so I think that also when we're talking about this and when we're casting our votes, we also need to change the language that we use to try to make sure that folks know, that parity means parity, right? That we treat this like we would treat it if you had cancer or you had, an immuno sort of disease, all of these other things that we treat far more seriously, quite frankly, than our mental health. And then, number 3, I do want to mention that we do have an opportunity to create change locally right here in Sonoma County. Measure O is on the ballot, which would provide increased funding directly for mental health services in Sonoma County. Unfortunately, it feels like our mental health safety net has been kept together with duct tape and baling twine for far too long. Unfortunately, as costs continue to increase and as the demand for services continue to increase, we have not seen a commensurate increase in state or federal funding. So please get out there and vote for candidates who support these causes and look into Measure O and consider that supporting that on the ballot this November.
Thank you, Linda. Yeah, I hope that Sonoma County will be able to continue to support programs like this going forward into the future to help more people who are in need, especially early on in the course of their illness. Question from Jackie Stevens, who's a viewer. Thank you, Jackie, for your question. Are there examples of how these types of clinics have helped and made an impact in other counties? I think, Tara, that's another one for you.
No problem. Yes, there are so many examples of how these clinics help. I can give you some from my clinic. We had a number of folks graduate from high school, graduate from college. We've had folks get master's degrees to pursue their careers. Folks get married, folks have children, come back to family that they had sort of become separated from because of the stress of the illness. All of these are examples of people just pursuing their lives and their dreams. When I meet with parents, when someone, has the onset of this illness, I'll get questions like, are they going to be able to go to college? Are they going to be able to have a job? Are they going to be able to get married and have kids? And my answer is, well, yeah. People have this belief that this is going to completely take you away from the things that are important to you. And our goal is to say, hang on, we may need to get off the highway and get on this dirt road, but because we're going to slow down a little bit and we're going to put treatment, like if you had a flat tire, okay, let's get off the highway. Let's be safe. We're going to take care of your car. Maybe we'll drive a little slower along this side road for a while, but we're going to have you get back on the freeway. Our goal is not to turn down some other road and go some other direction. It's to really continue with your life. And so that's the approach that we take when folks come into our clinic. So I think all of the good things that you can think of for people, those are the things we see in our clinic.
That's indeed something to aspire to for anybody. I mean, people who experience mental health challenges, they're people like anybody else. I can attest to that firsthand, and I'm so glad to see the young people in clinics like this that I've worked with in the master's program that I mentioned earlier, do amazing things in their lives. Like one became a firefighter, when he graduated from the program. I'm just so proud of him, and it's just inspiring to see them go on to do these great things for their communities and for their own lives going forward. So it keeps me going to know about that success. Thanks, Tara. Do you have another question about, let's see, where is it here? How the outreach works and how we get the message out to providers in the community, schools and pediatricians?
Great question. I think one of the things that I have seen to be most successful is to have those meetings, because we want to understand for the schools, how do we connect people quickly with our program? What is the best way for the teachers, the counselors to communicate with us? So this program will be having meetings in services, whatever works well for the school and those professionals to figure out how we build that connection. Same thing for pediatricians. I'm sort of known for talking to literally anyone who will listen to me. It'll be 100 people. It could be one person. If you want to talk to me about this program, then that's what I'm going to do. And that's the sort of outreach approach we really try to instill in our programs. And I know, having worked with Aldea in 2 other counties that that's the approach they take as well. So it'll be great to get Buckelew and On the Move engaged in that work and really get the word out there in the Sonoma community.
Awesome. I hope you stay on that soapbox and let more people know about your passion for this and how great it is for so many. A question I'd like to ask David and Seong, how else can Sonoma County residents improve support for mental health care in their county besides Measure O?
Well, first of all, this is something that we need to talk about what's going on within our community, and with the change of language, but also promote this idea within the school setting and anywhere that our children goes and participate. And to do that is to talk about this particular thing with the dispelling the stigma associated with the illness and opening up the conversation. And David and I, we would very much love to have that advocate those activities, so that if anybody wants to talk about this at a school setting or within a community members, we'll be very happy to come and share our experience and help to start the conversation.
Yeah, certainly being able to communicate to community leaders, superintendents of schools about this program, that the program is here, it's available to people to be referred to, that, and we intend on doing that. We've done a lot of that outreach already. We'll continue to do that outreach so that everyone in Sonoma County doesn't have to look for that bathroom in the stadium. There's going to be bathrooms all over the place, and they know where to go.
I feel that it would be helpful, and I think that the member of community come together and wanting to do this, not just us, but anybody, whether you have someone, loved one is suffering with the illness or not, this is responsibility of all of us. And that we need to really understand that when one suffers in our community, when one suffers in our family members, all of us suffer. So we have to take responsibility and really advocate. And I like to use word building the barn, that when someone is ill, we all should come together and build a barn for that person. And that's the only way this will go forward and will have good result and help our people to feel better and become that productive member of society. And we all want that, whether it's yours or someone else's. So I would love to be able to help anyone who wants to talk about it with their community members and their leaders. And we'll be there whenever they are ready.
Seong and David, you're so dedicated. I can't get over how much I admire how dedicated you are to the advocacy that you do and helping other people with the challenges they face too. So thanks for all your advocacy and all that you do. And I echo what you say. I do have a question for, let's see, so about children and how do you know what to look for in their mental health? So maybe this question for Tara, or potentially Linda or Patrick, who mentioned that we're concerned about the kids in our lives and our communities. Who would like to take that? For example, risk factors. Are there certain risk factors or warning signs for mental illness that we can look for? Tara, would you like to take that?
Sure. I think what I like to say is there's generally 3 people who know kids pretty well. Parents or grandparents, if they're really close, but family members, teachers, and pediatricians. And so when you start to see that a child is struggling, socially isolating, seeming more sad or quiet, not engaging in things that are fun for them, withdrawing and not doing well at school, those are really clear markers that something is going on. And it could be many, many different things. But to take the time to ask that child or that youth, hey, I'm noticing this or this, I'm wondering what's going on. And I think right now what we're seeing is many parents are struggling to manage all of the things that are happening in their life. And so just really trying to make a quiet, safe space where that young person can talk, to take that time to engage with them and just point out the changes that you've made and to really listen to what they say and not discount the concerns that they have about not seeing their friends or all their classes are online or people are picking on them on social media. These are stressful times for our youth. And so looking for those changes in the youth, picking up on that and talking to them and asking them about it. Those would be some of the most important things I would encourage folks to do.
Mm-hmm. Good to look for those things for sure. Patrick.
So I would say that, obviously we want to normalize mental health. Everybody is going to have challenges, some more than others. A lot of it driven by genetic predisposition, just like with other illnesses. A lot of it obviously triggered by our environmental factors. But the bottom line is we have to take a population health approach. We can't wait till people get really ill, which is why this is such an important program. But in the education system, I think as Tara mentioned, you go where the kids are. Where are the kids? They're in school. Why don't we educate our educational leaders to really incorporate this? First of all, my wife, a public school teacher for 14 years, they'll screen for eyesight, they'll screen for hearing, they'll screen for scoliosis, but they won't do a checkup from the neck up. And thanks to kind of what One Mind is doing with their longitudinal research studies on traumatic brain injury, we're learning a lot about, what are the biomarkers for people and how to subtype who fits into what risk pool of folks that need to get extra support. And what we ought to be doing is kind of triaging people throughout the course of their lives to see where they're at highest risk. If they've got, as the ACE studies have shown, with Kaiser being one of the big champions of that, we know there's a correlation for people that are exposed to certain factors having certain outcomes. And so what we ought to be doing is taking this kind of approach across the board. And I really can't say enough about better diagnoses, which is what this is all about. Because people can get lost for years, not being able to find that proverbial bathroom in the stadium, because it's a one-size-fits-all today. And so I like the idea of specialty services for a particular type of diagnoses. That's not to say that we don't employ, in a macro way, cognitive behavioral therapy, but we apply it based upon, whether it's someone with a body dysmorphic situation, a panic, depression, even specified CBT for those who've had suicide ideation, and people who've had a psychosis. There's strong evidence to show various specific types of CBT can work depending on the population that you've accurately diagnosed, but we're not accurately diagnosing. To Claire's earlier point about not being able to differentiate between kind of all the things that might have been going on with our brother. I'm just here to tell you, this world is changing quickly, and we are really on the cusp of major, major change. I want to thank you, Brandon, and your family, because I think the neuroscience part of that is going to be a big game changer. If people understand, Seong, to your points about stigma, the neurobiology, the genetic predisposition for these illnesses, as our good friend Steve Hyman is doing at the Broad Genetic Research Center at MIT, or Eric Nestler, what's going on Matt State up at UCSF. These people are the astronauts of our generation. They are looking to try to connect the dots to help individuals get specific treatment, both medication specific and therapy specific, that'll give them the best shot at recovery. And I just am so honored to be with all of you today. And I want to particularly thank Linda for calling out that we need to do a better job at identifying where our political leaders are on these issues. And for one, Linda, I'm going to ask Brandon to make sure he sends me a link for a future event that you may have, because I want to support you. And we need to support those that are there for us. I can recall when I was in Congress fighting on these issues, there were only a handful of people that ever supported me. There was no major political action committee. There was nobody giving politically except the Staglins. And the Staglins knew that politics was important in order to get the results that they were fighting for philanthropically. You needed to do both. And so I want to support you, Linda, and I want to help all of those who are trying to build better kind of accountability metrics, so we know, is supervisor X or Y doing what they really need to be doing. So that's the future of advocacy. And I hope you all have a great rest of the day. I've got 5 kids, so I have a vested interest in getting this system improved, because knowing of the ratio of people who need help, I don't want the current system to be the system they have to grow up with. That's my motivation. And I appreciate, Seong, you saying that this is, Claire, your dedication. This is not satisfactory. It involves all of us. We all will have be impacted by this. Question is, are we going to have something that works, like Spire, an example of what Elizabeth's work to try to help her friends who are also going through this, and Seong and David's example, or are we going to be stuck because we don't step forward? So I wish you all a great rest of the day, and onward, as Garen, Brandon, your dad likes to say.
Yeah, thanks. I just get so energized listening to you talk about the advocacy that we can all do together. And the Kennedy Forum, and you've been such a leader in that for so many years. And touching on some of the science that One Mind supports, also to help young people who are at risk for serious mental illness. So we did a workshop, a whole think tank series of meetings with experts from around the country, including Tara was one of our great experts, talking about how we can screen young people in schools and in pediatricians' offices and other settings, to see who might be at risk, and then refer them to the care that can really help them to get back on their feet. And so we do a variety of things within the Aspire initiative to do this. The Elizabeth Morgan Brown Center is kind of the flagship clinic delivering this kind of care. And we'll pilot some of these innovations within this clinic through Tara's work with the research she does. Patrick, thanks for being with us today.
You bet. If I were there, I'd be voting for zero. What is it? Zero? O? What is it? O? Referendum O?
Yeah, that's it. Measure O.
Measure O. Okay. We all got it. Measure O and SB 855. Specific things you can do on this call afterwards to advocate for better work. And thank you, Brandon, for 1315. That's great. Have a great day, everybody.
Bye, Patrick.
Thank you, Seong. Thank you, David.
Thanks for joining.
Thank you, Patrick.
Bye. See ya.
Yeah, we've got some great comments pouring in from the viewers today, and some questions here from the viewers. Question from Shirley Zane, Supervisor Shirley Zane. Shirley, thanks for being with us today. In your question, so many families suffer silently when they lose a loved one to suicide. How can we reach them to give them the support that they need? She intended this for Patrick. He just left, but anyone else can answer that. And who would like to take that? How can we reach families to give them the support they need if someone is at risk for suicide? Maybe
I can take it, Brandon.
Sure, Tara, yes.
Yeah, no, Shirley, thank you so much for this really important question. We've seen drastic increases in suicide, particularly in our youth. So, and it's devastating to families, as David and Seong have shared with us. I think one of the challenges is we don't have good outreach to those families. I would say that NAMI is probably one of our best resources, but they are working so hard to cover so many areas. I would like to see communities step up in this area to take away the stigma around suicide. To have someone die by suicide in your family is not usually something where people bring you a casserole like they do if someone dies from cancer, and that should not be the case. So again, I think it's about reducing stigma and creating opportunities to reach out to those families in very gentle and connected ways so that they can come together and get the support they need. Mental health doesn't just affect the individual, it affects their system. And I think the more we can recognize this, the better.
That's so true. Thank you, Tara. Another question from or actually a comment from the audience, Belinda Biscocho. Thank you for your comment. Thank you, Elizabeth, for the voice, the light, the inspiration, and the hope relaunched today through One Mind Aspire. Thank you, Seong and David, for sharing, showing, and leading the community to the bathrooms in the stadium. Let's keep it spreading, moving, and outreaching together, mind to mind, heart to heart. Thank you all. Thanks, Belinda. Thanks for your support for the work that we're all doing together. Glad you could be here with us today. Wonderful. Okay, another question from the audience that came in a little while ago. Robin, you might want to answer this one, and others can jump in too, but why does Kaiser refer adolescent mental health patients to Sonoma County? Do they do this for patients with physical illness as well? So it's not only Sonoma County, but would you like to speak to that, Robin, please?
Yeah, I think I'm not sure at what level of care that they're talking about, but Kaiser doesn't have their own, enough psychiatric beds. We have one psychiatric hospital in Santa Clarita and one psychiatric hospital for those that also have a coexisting physical condition. So we use community partners where we aren't able to fulfill the need internally. Another example that's not mental health, but just to give you an example, for instance, for large organ transplant, we partner with UC Davis, we partner with UC San Francisco and other large health systems that do large organ transplants. So again, in mental health, for some specialized care, if we don't have the internal capability, we use referring centers. And again, so the this Aspire clinic will be a referral source for very specialized care, of which we don't have this program internally. We are also doing that with the Aldea clinic, and Carrie Hearn is on the phone, and Tara works on that project. So those are other examples of where we learn from the community, and sometimes we take advantage of those services and do referrals. So thank you.
Mm-hmm. Great, thanks for clarifying that. And I'm so excited to partner with Kaiser to deliver care to those who can benefit from it within the Kaiser network, to expand the network's ability to care for its members. Yeah. Great. Just a couple more questions I have for the participants today. And remember, you can ask any questions from the audience you like, still ongoing for a little bit longer if you want to stay on. Claire, if you had a wish list for mental health practitioners and how they should work with their patients, what are the top 3 things that you'd recommend?
That's a good question. I think that first and foremost, like we've been talking about, humanizing the experience and treating them with dignity and with grace and with understanding. And as David and Seong have been mentioning, nobody chooses to be in this position. And so giving them the compassion that we give so many who are facing physical illness, I think meeting sufferers of mental health with that same intention is really important. So that would be my list.
That's fantastic. You're going to be a great psychotherapist with those priorities in mind. Thank you. Question for Linda. Much of Sonoma County, including your district, lives in rural areas, remote from this clinic's location in Santa Rosa. What can the Elizabeth Morgan Brown Center do to best meet the needs of these residents?
You know, that's a great question. And especially for a lot of our communities, I actually represent some parts of the county that are an hour and a half drive from Santa Rosa. And sometimes it's very impassable, especially when the weather's bad or if we have minor flooding along our roads. In that case, virtual visits are so critical. And so I'm thrilled to hear that the center is offering that as a service. I think that's going to be critical for our rural residents. You know, I'd also like to touch briefly on that last question, you know, which is sort of the interplay between county government and our local healthcare system. And I think that's something that will benefit all of my constituents, whether they are rural or urban, is just continuing to work together with our healthcare partners to strengthen that safety net. Because unfortunately, you know, I continue to hear concerns like those expressed by David and Seong of people not knowing exactly where that right door is to enter the system of care, or folks not exactly sure which system of care they fall under, because the county has certain responsibilities and then our private healthcare providers have certain responsibilities. And so I just really appreciate the fact that, you know, Kaiser is actively supporting this program and that they continue to work with us to try to strengthen those partnerships as a whole. Because at the end of the day, we just need to make sure that we've got a robust system so that whether you are in a small unincorporated community or an urban city, that you know where you can go to get those critical services.
Hear, 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 hear. Everyone needs access to care. Everyone has different mental health challenges, and I hope that people who can benefit from this clinic will access it. So let's see. Perhaps one more question for Seong and David in closing. What's on the horizon for One Mind Elizabeth Morgan Brown Memorial Fund?
You want to go?
Yeah, we well, as you know, Brandon, we had done a music program last fall as a fundraiser, kind of falling back on how our partner One Mind has been able to raise funding for the programs that they put on. It was a very special program that helped raise funds to help get this program going with the other partners that we've had. And we'd love to do that again with the pandemic that we've been having. That was not going to happen this year. But we hope to, in the future, be able to do another musical event, since music was very important to Elizabeth's life and our whole families. And I don't know that anyone else knows this, but you probably know, Brandon, that Elizabeth was not only a classical musician herself, but she also enjoyed Korean pop music, and at one time had aspirations of becoming a K-pop star. And so we've got aspirations of getting the current big K-pop band to come and play for a musical event, a fundraising event to help the Elizabeth Morgan Brown Fund grow and expand. That can help us grow and expand not only in Sonoma County, but in other counties throughout California and eventually the nation. I mean, this is a program that we truly believe is going to have a significant impact on our communities in the short term as well as long term. And why not have it throughout the country? You know, we have such a huge homelessness problem right now that this can help diminish that, because these children that are ending up not getting the treatment they need and the support that they need end up with substance abuse and end up in homeless situations. A very high percentage of homeless folks are in that situation. And if you can catch it early and get them on the right path to recovery, I think we're going to have a significant impact in the communities. And we definitely are just getting this started. There's so much more to be done, and we're gonna keep at it.
Those of you who don't really know this K-pop band called BTS, I've been keeping my eyes on them for some time. And the reason is that they are very much, their genre and their subject of their music is about mental health and societal issues that the young people are challenged with. And it's impacting and touching a lot of the hearts of young people worldwide. And that's the reason why they're very popular and they're winning lots of music awards at this point. But the reason that we want to do this is that we want to be able to expand all over the, not only state of California, but all over the United States and even for the world, because young people are our future, and we really need to pay attention to their well-being, not just only doing well at school, but just in all around that we tend to not really pay attention to. So this is something that David and I were very much motivated and inspired, and I feel like Elizabeth has been, her spirit's been nudging us to keep going with this. So I just like to encourage everyone, whether you're from Sonoma County or from other parts of the state, United States, that a lot of you are friends of mine and they understand my story and know about it. And you all can be leader and advocate for this, and we can work together, and we are going to be there whenever, however you want us to help you. So it's thinking about that gives us reason to get up in the morning and keep going.
And if anybody has any connections to any concert promoters that could help us get a connection with BTS, that'd be awesome.
You guys rock, David and Song. You guys are so awesome. I really admire that, the ambition to have BTS play, and happy to help that make that happen if we can do that through One Mind. We do our music festival for brain health every year. We do have connections with people who know music, people in music, and so let's talk more about how we can make that happen.
Yeah,
great, and make this even a more nationwide, worldwide thing that we're doing, like we're doing today. Thank you. Okay, so thank you everybody for participating in our live stream today. I want to thank all the panelists, Robin and Carrie, Robin and Tara, and David and Song, and Patrick, and Claire and Linda for being with us today, and especially all you viewers who've been with us today to watch and participate in this great grand opening event for the Elizabeth Morgan Brown Center One Mind Aspire Clinic. I hope you'll reach out if you need access to care. Can we please go to the slide? Please call 707-255-1855 and ask for Jackie Aguilera if you'd like to learn more about this clinic and how you can find help. So everyone, thanks so much for being with us today, and be safe, and please share what you learned far and wide. Thank you so much.
Thank you.
Thank you, everybody.
We've seen the ground of this well-trodden path before. The path that leaves us lonely and unsure. We try to run from the situations we're forced toward. What do we do? For the answers seem obscure. 1, 2, 3, 4. Break down those barriers that you preconceive, for you are the only one standing in your way. Be your own inspiration. inspiration, there is everything to achieve. Your inner universe should shine every day. The world is meant to be seen through your eyes. This place is beautiful if you want it to be. What lies within you will raise you to the skies. What you decide to be will set you free. You have all the answers, now don't be afraid. Love yourself in every way. The deep blue ocean still kisses the shore. The grass still sways with the breeze. The sun will rise for you to adore, and love sings on the feeling of ease. You are not made up of words of undervalue. Wash off what society painted on your face. Take off your blanket of self-doubt, it's true. We are a fearless, independent, original race. You have all the answers, now don't be afraid. Love yourself in every way.